welcome back. Professor Klein here, taking you through the second part of the elbow and the wrist lecture, and we are on to the forearm muscles, working our way down from the shoulder, from the elbow. Now we're on the forearm as we extend out to the hand and the fingers. And from this first slide here, you can see the forearm muscles are broken down into two major sections. We've got the extensors, which are going to be posterior. All the extensors are posterior on the forearm here. And then the flexors, we're talking the anterior forearm there. And we know the forearm is the antebrachium region of the body. All right, so let's look at our flexors here, and there's quite a bit of muscles in your forearm. I never thought there would be 20, 30 different muscles in each different compartment, but there is. So with the flexors here, again, flexors, anterior, and we can see there's things like a flexor retinaculum, which is down at the wrist, which all of these tendons will run underneath. Three different groups of the forearm muscles. Here's probably the best picture of all of those forearm muscles. Is superficial, intermediate, and deep. So three different levels of the forearm muscles. A majority of them coming from, notice this right here, coming from the medial epicondyle. So feel that medial epicondyle. A lot of the flexors are coming from there. They originate at that medial epicondyle, which is why, one of the reasons why that bone is so big. And then we start looking at the names of some of these muscles, and they can get kind of complex. So we can look here, things like the Pronator Arteries we've already looked at. F means flexor in all these situations. So flexor carpi radialis, palmaris longus, flexor carpi ulnaris. A little bit of Latin in there for sure. But what I will tell you is I love the forearm muscles because within the name, it will tell you everything you need to know about that muscle. We'll talk more about what that is in a moment. And let's not forget about the brachioradialis. It's an exception, technically part of the flexors, but it's kind of on the middle of the flexors and the extensors, and it does elbow flexion as well as a few other things. So this is your brachioradialis right here. So we kind of throw that in with the flexors as well. All right, and here we can see three different views of the flexors. You've got the superficial view over here, and then you've got more of an intermediate view in the middle, and then a deep view on the far right. So again, notice over here, all the muscles are shown on the superficial. You can see the supinator coming across the lateral side, thumb side lateral. But then it looks like you have 1, 2, 3, 4, 5 different muscles packed in there on the superficial view. And that would be correct for those 5. However, note that 2 through 5 are all the same muscles, even though it looks like a different muscle or different divisions. For sure, it's the flexor digitorum superficialis going all the way to the fingers. Now, this is why I love the names of these muscles. The flexor will tell you it flexes something on the anterior side of the forearm. Digitorum sounds like digits, tells you it goes all the way to the digits. And then superficialis will tell you, well, there's another flexor digitorum, which we know there is a deep one called the flexor digitorum profundus, which is the same thing. It's got multiple divisions going to each digit over here, but the profundus goes further. The superficialis stops before that. So the superficialis is superficial. It actually stops at the middle phalanx, and the digitorum goes all the way to the distal phalanx. A key distinction between these two. We'll look at that more closely very soon. Also notice the nerve coming down the middle. This is that median nerve. So median nerve traveling straight down the middle. The radial nerve, which we can see is posterior, radial, posterior, coming down the posterior side. And then that ulnar nerve, ulnar, medial side, it's in line with the ulnar bone. Or rather, ulna, which is the bone that is parallel to the ulnar nerve. All right, so let's look at that superficial layer of the flexor forearm muscles. I've labeled them out here, 4 different numbers. So as you can see, the pronator teres, we've looked at that. Pronation of the forearm, that's going to be first. You can also look at it over here in this view, where it shows you the origin, that medial epicondyle, coming down to the radius itself down in here. So they're very much bunched together. We won't focus as much on origin and insertion, but it's always good to know some general spots. Next is the flexi carpi radialis. Now, when you think of this, flexor, carpi sounds like carpals, which means this muscle is going to travel down and stop at the carpal bones. Think of your carpals as your wrist. So this one's going to stop at the wrist, which means, lastly, the radialis, it's on the radial side, or the radius, the side of the radius. But if it stops at the carpals, can it have any actions on the fingers? No. It has to cross to the phalanges if it's going to flex the fingers. So this one would just be a wrist flexor. Wrist flexor, not a finger flexor. Same thing with the palmaris longus and the flexor carpi ulnaris. The ulnaris is just the opposite of the radialis. It's on the ulnar side, number 4 right here, travels down, stops at the carpals. The palmaris longus is the one that we said is not seen in everybody, but it's going to be the one right in the middle, and it's going to stop, same thing, right on the wrist, similar to the other muscles. Here is a cadaver picture of really the deeper structures of the forearm. Not going to test you on this picture, just want you to kind of see it. It's very similar to the pictures in your book. You can see it, different nerves coming through. It's the ulnar nerve here. Median nerve is deep within there. Trying to find it here. We've got the flexor pollicis longus, one muscle for your thumb, flexor digitorum profundus, flexor digitorum superficialis. So a lot of muscles have been peeled off of there already. This is the median nerve. It's actually been pulled back, but you can see it innervating the hand and the wrist. Before we break down each one individually, let's look at the Brachioradialis as this one on the brachium. We're going from the brachium, the humerus, down to the radius. And really you can see this muscle here when you hold a weight or something in a neutral position. So neutral position, you really can see that muscle pop out because that's the best line of action for that muscle. So try that out when you're holding a weight or a large glass of lemonade for the brachioradialis. But back to those forearm flexors, a great way to memorize those is by putting your thumb and fingers on your medial epicondyle. So try that out now. Mimic this picture. It doesn't matter which side you go on. You only have 2 arms. So one is going to grab and the other is going to extend it like this. And when you label your fingers, these different 4 muscles, it will tell you how they're set up in the body. Now, what I like to do is I like to take the flexor carpi radialis and the flexor carpi ulnaris, and I like to form kind of 2 different borders. So now I have a lateral border and a medial border. I know the palmaris longus is in the middle. And then I know the pronator teres is not extending all the way down. It's staying up towards the elbow there as well. So that helps me remember these four as the superficial four of the flexors. Here are the tables for you if you want the full tables. We will focus more primarily on the nerve and the action. So don't worry so much about the origin and the insertion unless there's a common origin and insertion, and in this case, medial epicondyle, medial epicondyle, medial epicondyle. You see that pretty much everywhere, so make sure you know those common origins. But we want to focus in on the fact that these two flex the wrist, and the palmaris longus, it's, like we said, more spare parts if you have a Tommy John surgery or something like that. But it doesn't really do much, and it's not always present. But do know that one. The other two have opposite actions secondarily. So the radialis on the radial side abducts. So it would be going this way with it. The carpi ulnaris on the ulnar side would pull the hand that way and adduct the wrist. So they have a common action, flexing the wrist, but then an opposite action with that deviation. Furthermore, they also have a difference in the nerve. So the flexor carpi ulnaris is the one muscle on the flexor side that's innervated by the ulnar nerve. The median nerve pretty much does everything else on the flexor side, but that ulnaris, it has the word ulnar in it, is the ulnar nerve. All right, getting to the intermediate sections here, really just the flexor digitorum superficialis. Again, flexor, anterior side, gonna flex something. Digitorum, we're going to the digits down here. Superficialis, it says superficial. There's another one just like it, but that's deeper. Notice each section of the muscle, 4 different sections, like I said before, travels to each of the digits except the thumb. The thumb has its own muscle, flexor pollicis longus. We'll look at that later. So this muscle right here is separate from these 4. Flexor digitorum superficialis has the 4 tendons for here, which means you can flex each digit separately. If you didn't have those separate divisions, you would have to do it all at once. But luckily, you can do each digit individually. All right, so let's talk about the difference between that flexor digitorum superficialis and the flexor digitorum profundus. You will need to write these out entirely. The abbreviations are here, but don't rely on the abbreviations. Rely on knowing the entire name of that muscle. Now, here's the main difference that we see is that we've got flexion of the wrist for both because it's crossing the wrist on the anterior side, but the digitorum profundus, which travels further, is going to go to the DIP joint. So let me just write in DIP joint here, but up here the superficialis, which is on top, stops at the PIP joint. So it cannot have any action on the DIP. It only has action on the PIP and the MCP joints because it stops before it gets to the DIP joint. All right, I skipped way ahead in the PowerPoint just so we can see this real quick. But what I'm talking about here is that the flexor digitorum profundus, it actually will travel through the flexor digitorum superficialis. There's a split, and it goes straight all the way to the distal phalanx. So when you think profundus, I want you to think profound, all the way to the distal phalanx, crossing that DIP joint. But the superficialis, it stops at the middle phalanx. It does cross the PIP joint right here and the CP joint, but it has no action on that DIP, and now you can see the difference in the length between those two muscles. All right, time to get even more complex with it, because I said pretty much everything's median nerve on that anterior side, and that's definitely true unless you go deeper. And then when you go deeper, we're talking about the profundus having median nerve on the second and third digits, but ulnar nerve on the fourth and fifth. That kind of makes sense though, right? Because fourth and fifth digits, pinky, ring finger, that's on the ulnar side of the forearm. So that's where the ulnar nerve is. It's all about proximity. Function follows form, especially when we can see these divisions. Look for some questions on your exams about specific details like that I'm highlighting right now. Let's put a star around it. You can put a star around it in your notes as well. All right, let's keep going, Professor Klein. Let's get on to the deep flexors of the forearm. And we've already hit on one of them quite a bit, this flexor. Oops, let me get some, there we go, more color in there. Flexor digitorum profundus. We've already hit on that. We've already hit on the pronator quadratus in part 1 of this video, but let's look at the flexor pollicis longus. This is really where the anatomical terms can help you out if you learn those really well. So flexor, we know it's going to do some sort of flexion, anterior side. Pollicis sounds like pollicis, which is your thumb. So this one, it's going to flex the thumb. We got a specific muscle just for flexion of the thumb, and it's called longus because later when we look at the hand specifically, there's going to be one that's a brevis. Brevis is short, longus is long. So down here we can see that it is going to flex the wrist a little bit, but mainly flexes the MCP and IP joints of the thumb. You can see those joints right here. This is the IP, this is the MCP joint. It's doing double flexion with the flexor pollicis longus. Median nerve for this one, it's on the anterior side, it's superficial median nerve. Here's another look at a cadaver of, this is more the extensor side, but I just want to highlight from these pictures that a lot of the muscles are up in the forearm, which is why your forearm is thicker than your wrist, because the muscle part, the actual muscle fibers are up in your forearm. But as you get down towards the wrist, it mainly just becomes all tendons. So the tendons are very small, very thin, and they can kind of not take up a whole ton of space as they go out to the fingers. Now, it would be weird if we had all the muscles here going to the hand and the fingers, because it would be like we're holding dumbbells or a kettlebell, and it would bubble out as we get towards our hands. But we know the muscle part's up here in the forearm, and then the tendons go out towards the hand. All right, time to jump back to the weight room and figure out how to strengthen the forearms. But you know what? You don't have to be in a weight room to work forearms. So let's go to office. Now I'm talking a lot with my occupational therapist who will be doing a lot of work on the forearm, wrist, and hand, on something like carpal tunnel issues, repetitive use of maybe the mouse, or this guy right here, working on his laptop, kind of hunched over, a lot of occupational therapy, different muscles, get them strong, get them free, to use to do the job well, actually plan for their job. So back to the actual strengthening though. This is in a gym, and if you wanted to strengthen your forearm muscles, the anterior flexors, just the wrist flexors though, you might take a weight like this and just perform wrist flexion against that weight, or a stress ball. And sometimes you have different machines, like this guy's got something on his arm for wrist flexion. People are making money off some of the craziest things, but it looks like it might work. But don't let the picture deceive you. We can also talk about flexor stretching. So stretching opposite of the action. He is extending his wrist. He's extending his fingers. Try that out. Give it a try. This Professor Klein does it here. Do it with Professor Klein, and really what you're going to feel is a stretch going on in that anterior compartment. This is great for after long days of studying or being on the computer where your wrist is flexed with your mouse and your laptop. I mean, take 5 minutes, stretch out the fingers, stretch out the wrist, and they will really thank you later. All right, it's time for the extensors now. We got to talk about all the extensors on the posterior side of the forearm. All right, so we are posterior, and what I love about the posterior muscles is that they truly are all radial nerve. So anything posterior, I want you to say radial nerve. Say that with me. Posterior forearm, radial nerve. And really posterior brachium, radial nerve. Posterior hand, radial nerve. The radial nerve is posterior. All right, so radial equals posterior. We got that down. Time to move on. Extensors are posterior. So everything in the back side is going to do some extension as well as abduction and adduction of the hand and the wrist. We extend all 4 medial digits. A little less action going on with the extension. I mean, you can extend, let's say, the MCP and the DIP, but then you can flex the MCP and make like a plank with your fingers. You can do kind of a claw thing here, or you can extend all 3 of them together. So we'll look at the muscles that do that. And with extension, just to orient yourself real quick, you want to make sure you see the olecranon with the triceps coming down into that olecranon as the insertion point for that. This is where the brachioradialis kind of comes over the side, but again, brachioradialis more a flexor than an extensor, even though it's innervated by the radial nerve. But then we can see similar names like the extensor carpi radialis brevis. If there's a brevis, there's a longus, that's number 2. These you can form together, and same muscle, but one's a brevis, one's a longus. They do the same thing, but they're different divisions of that muscle. We also have an extensor digitorum. Extensor going to extend, digitorum, the digits. So this one's coming all the way down, and then just like the other one, it splits into 4 different divisions and will extend these digits, as you can see here on the back side. But we're not done yet, because we've got an extensor carpi ulnaris. Ulnaris, pinky side, going down to the 5th digit here, but it's carpi, so it's stopping at the wrist, just like the extensor carpi radialis brevis. Same thing as up here, is going to stop right down in here. So do note they've labeled this one twice. Extensor carpi radialis brevis, just so you can see it. There's a few for the thumb. We'll look at the thumb one specifically, but then notice this one's a flexor. So from here over, and let me maybe give it a little bit of color for you. Let's go pink. No, Professor Klein, let's go yellow. There we go. That really shows up better. This one right here, it's a flexor. Even though you can see it from the posterior side, there's a little bit of wraparound that occurs, but take that one out and you'll be okay with the extensors. I'm not going to read through all these tables for you, but you can do that on your own time. I do want to note though, talking radial, 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 radial. Different versions of extending the wrist, but then you'll notice that some abduct the wrist and then some extend, let's say the finger at the MCP joint with the digitorum right here. Now I do want to note the extensor digiti minimi, digit minimi, the smallest digit, the pinky. So you have one muscle, the extensor digiti minimi, that's going to extend just the pinky finger, that smallest digit, and that is the extensor digiti minimi. These also have a common origin, the lateral epicondyle. Flexors were medial epicondyle. Extensors are lateral epicondyle. Here we can see a few different levels of the extensors. You can see a lot of muscles have been removed over here to expose the deeper muscles. You can still see the extensor carpi, radialis longus, and brevis, but now you can see that supinator, which is deep in there, that supinator. But let's add in the pollicis muscles. So we have 3 pollicis or thumb muscles on the extensor side: abductor pollicis longus, extensor pollicis longus, and extensor pollicis brevis. Remember those, because those are going to make a very important snuff box right here. So remember these 3 for later. We also have one called the extensor indicis. Indicis, I want you to think of index finger. When you point, the reason why you use this finger is because it's got that extra muscle which allows you to direct it and point it closer to there. If you're a Seinfeld fan, you will understand what this means, but this is good control of the pointer finger. And if we go super deep with it, super deep here, we can see that extensor indicis. Most small muscles are super deep, tucked underneath the bigger ones. Supinator, now we can see that full muscle. It's bigger than it was before, but this is a full look at it. As well as the extensor pollicis brevis coming out to the thumb. Extensor will extend, pollicis the thumb, brevis, well, that means there's a longus, and here's that longus, which would be over top of the brevis. Table boxes or muscle, table box muscles, whatever you want to call them, are right here for you. And again, we're talking about some common things. Radial nerve, radial nerve, radial nerve. All right, you get it. Extend the wrist, extend the wrist, extend the wrist. Great. But now we look at some of the details. For example, abductor pollicis longus is going to abduct the thumb. Abduction of the thumb. Pull it away from the rest of the fingers. Whereas the extensor carpi ulnaris will adduct the wrist. This motion, bend it towards the pinky. But then we even have more up here, the extensor pollicis longus, going to extend the thumb at the IP joint. So this little extension going on here. Let's zoom in real close. So this is the IP joint. That extension that occurs right there is from the extensor pollicis longus. 2 more boxes for you. Extensor indicis, second finger, right? Second digit, pointer finger, whatever you want to call it, but make sure you know it's the second digit of the hand, and it is doing that extension of the wrist, but more so extending the finger with the radial nerve, whereas the extensor pollicis brevis is doing more of extending the thumb at the MCP joint. So MCP joint, we're talking more about this joint right here. So if this were to let's say extend without extending the IP joint, this is what it would look like. And that's the extensor pollicis brevis. All right, let's talk about how you strengthen these. And again, strengthening is the action against some sort of resistance. Now, if you were just to extend your fingers or extend your wrist, that definitely could do it. And let's say you got that weight in here and you're doing some wrist extensions, great job. But specifically with the fingers, you need a little bit of resistance. So there's these things, these web-like resistance bands that will prevent you from extending your fingers. Sometimes I just use like a wristband here, even though this one's pretty tight, or a rubber band can strengthen those extensors. And then opposite of the action of extending is flexing. So right here, this lady is flexing her forearm, flexing her wrist so that she can stretch the extensors, and flexing the fingers to stretch the extensors as well. Now be ready. On your exam, I might show you a picture like this and ask you in the forearm what muscles are being stretched. And in this case, I'd give you A, B, C, D, and I'd name some of the extensors, and you'd have to pick the one that is part of the extensors that are being stretched. All right, remember those three muscles I said to remember from before that make up the anatomical snuff box. Now we are looking at these three right here. They're really the three on the extensor side that go down to the thumb and have an action on the thumb specifically. So what's going on here is this essentially we have the extensor pollicis longus, number one, and then we have the extensor pollicis brevis, number two, the tendon specifically, and then the abductor pollicis longus, number three. And as those come down and go to the thumb, they form this, let's call it a snuff box. In the olden days, they used to put snuff or different drugs in this area and sniff it from there, so they call it the snuff box. But we can see that box formed from these three muscle tendons. Specifically note, though, that really the extensor pollicis longus is the only one on top. So there's one on top, two on the bottom. So if I show you a picture that just has this one on the top being exposed, you've got to know it's the extensor pollicis longus popping out of this person's skin. Pause for a minute, because that's a lot of information. Flexors and extensors and the thumb muscles, almost too much to comprehend at once. Take a study break. It can be calming. Even have a picture of nature and some nature sounds. If you're not around a lake, if you're not around a lot of trees and stuff, pull up a YouTube video of the sounds of nature and kind of relax and let the brain absorb all that information. Then, when you're ready to jump back into it, take out a blank piece of paper and take just a couple minutes, list out everything from the extensors and flexors that you can remember. Try this out, take some time to do it, don't power through the whole PowerPoint, and then do it. Break it up into smaller chunks. It's much take a few minutes. I'm going to go maybe fish a little bit in this pond. All right, we're back here. Professor Klein got a nice fishing break in, and hopefully you got some nice relaxation for just a short period of time, because now we're back talking about some things specifically down at the wrist. So now we've got the knowledge that the muscles are up in the forearm, but they extend down through the wrist to the fingers. Now there's some specific things that will really be important to know in this area, and one of those are the retinaculums. So the retinaculums are like this thin piece of connective tissue covering the tendons. So it's like taking a piece of tape and putting it right here. So this would be the Extensor Retinaculum. Well, guess what? There's a Flexor Retinaculum as well. These pieces of tape or the retinaculum will hold in the tendons going through it. And it prevents bowstringing of the tendons. So what does that mean? Well, if you look here again, these would be like the tendons, and the piece of tape holds them tight to my wrist. If that piece of tape wasn't there, and you contracted these muscles and these popped out like this, and this piece of tape wasn't there, they would pop off the wrist and they would bowstring up like this. But you want tendons to stay close to the body so that, again, it doesn't become like a kettlebell. It stays very succinct and thin on the skin. So that's what's going on here when we look at the extensor or the flexor retinaculum and all the tendons that go underneath it all the way to the fingers. Now we're going to get into putting together different groups from the arm, from the forearm, from the hand of common actions. So for example, all the ones that do supination, all the ones that do pronation. Now here you can see a list of all the pronators, and sometimes it really helps to make a list like this instead of going through each of them individually. But we've already talked about the main two pronators of the forearm as well as the supinators. So we said the supinator was the main supinator, but when you have resistance, it's mainly that biceps brachii with some assistance from these other ones down there. And if we think of something like using a screwdriver, turning the doorknob on a door, that's some supination, pronation, supination, pronation, back and forth and back and forth and back and forth. And we have a lot of different muscles at play in that, but they produce what's called a line of force. So a line of force traveling up and around the forearm. So it's not just one muscle pulling in the direction of that muscle. It's a combination of many, many muscles making a line of pull, or the average pull of the muscles. And now we're back to the nerves as well. So let's throw the nerves in here. And this is a great shot of the brachial plexus. Remember that brachial plexus way up in here, and the nerves that travel down. Now they've been cut all except one. So for example, this is the ulnar nerve coming down behind that medial epicondyle, right? The funny bone, and coming down to these muscles. Ulnar nerve. Whereas the median nerve, now this one's coming down anterior cubital region to the flexors, and then the thumb. And then radial, we're going posterior with it. This is a pronated arm, so the thumb is over here, the pinky is over here, first digit, fifth digit, it's pronated. So this is actually posterior, and you know the phrase radial equals posterior. So this is all the radial nerve coming down. Those are the three that come from the brachial plexus all the way down. We know musculocutaneous would stop at the brachium, and axillary would stop at the shoulder. Remember the slide from before? Now we can add in the extensors because we know all the digitorum muscles. One extensor digitorum, but then a flexor digitorum superficialis, and flexor digitorum profundus, and how the superficialis splits and the profundus goes straight through. That's important because otherwise it would pull your finger to the left or the right. It has to be lined up perfectly in order to flex it straight down. So again, remember these insertion points, very important insertion points. Take 30 seconds and write this down, the difference between the flexor digitorum profundus and superficialis and their insertion points. I also want to note that the extensor expansion and a lot of different membranes as well as ligaments are connecting these two things as you get out to the finger, which again keeps them tight against the bone, which allows for full-on flexion. You're not getting in the way of the other joints. And if you take a biomechanics class, you'll talk more about the rolling, the sliding, and the actual movements of a joint. Let's talk about grip. Grip is super important in life. It's super important in your job. It's super important in really anything that you do. Maybe you're out fishing and you get a big fish on the line and you got to grip that fishing pole, right? I'm not a big fisherman myself, but I love to go and catch some smaller fish. And even the smaller fish can pull quite a bit, which for your grip, it is not just the flexors. So here we can see a lot of the flexors, digitorum, profundus, allowing you to flex your fingers, but you've got to have some counter pull, extensor carpi radialis, extending the wrist, keeping it extended. Now, if you were to just flex and flex and flex, your grip would be weak because when you're fully flexed, your forearm muscles are too short and thus they can't produce as much force. So counter it with some extensors, and then you have what you call the power grip. Power grip, super strong with extensors and flexors. So why does that happen specifically? It all goes back to the anatomy. Function follows form. If a muscle is too short, and think about the sarcomere, if the sarcomere is too short, then it's not going to have anywhere to contract to. And that's essentially what's going on here in a fully flexed position. The flexors are too short. See the tendon just kind of passively insufficient? You won't be able to create force from this. Up here, the extensors are almost too long. It's a bad position for the wrist to be in, very weak. Try to pick something up like this. You might even drop what you're trying to hold because you can't produce force. Conversely, try it the other way. Try to pick something up, this weight, and hold it extended. It's a lot harder than neutral. Neutral is kind of our best position because the tendons are in the optimal length on both sides. All right, take a few minutes, jump over to my YouTube channel and look at the hand grip experiment. That's going to show you exactly what I was talking about with the hand or joint position. This also references back to the question of lift with your legs, not with your back. Of course we lift with our back. Of course we lift with our legs. But it's about putting your joints in the proper position so that the muscles are the proper length, and there's the overlap between the thin and thick filaments of the sarcomere to produce the most force. So check this video out and then jump back to this PowerPoint. Okay, let's talk more about the ulnar and medial deviations going on here. Before we gave them to you separately, but here's a list. Here's a great list of the two muscles that produce adduction or ulnar medial deviation. I like ulnar deviation because it's specific to the ulna pulling in this direction. So the ulna would be down here. It's the two muscles that have the word ulnaris in it. One in the extensor side, one on the flexor side. Know this list. But also know the list of the radial deviators. Lateral radial deviation. We're going to the thumb side here and we're pulling it to the radius in this direction. It's got 3, and the only reason it has 3 is because there's a longus and a brevis for the extensor carpi radialis. So just know longus, brevis, special 2-part muscle here, but you got to label them separately when you're making this list of abduction of the wrist or radial deviation. Know these lists. Know these lists. Or if you want to know more what radial deviation looks like, here's a video. So check that out. Use that to your advantage. Here's a complete summary slide of radial and ulnar deviation together. Now, don't let this overwhelm you. It's just summarizing. Let's say, for example, adduction or ulnar deviation, flexor, carpi, ulnaris, FCU, pulling this direction, but it only does that deviation when you have the extensor carpi ulnaris pulling in this direction. Now, this is physics. This is physics here. And if you said, when will I ever use physics with anatomy? Well, here it is. So you pull in this direction a little bit, you pull in this direction a little bit. The net force is straight in the middle. Same thing happening over here with radial deviation. Flexor, carpi, radialis, pulls this way. Extensor carpi, radialis longus. Extensor carpi, radialis brevis, pulls this way, and the net force is right in the middle. You could keep going and you could talk about the flexors. Take a second. Tell me what muscles flex the wrist, and then which muscles extend the wrist. Are flexors, flexor, carpi, ulnaris, flexor, carpi, radialis, flexor digitorum profundus, flexor digitorum superficialis, and then we can even throw in good old fashioned palmaris longus. I forgot it there for a second. Palmaris longus does some very weak flexion as well. Now, how about the extensors? Stop the video, write them down. All right, here we go. And actually, Professor Klein forgot flexor pollicis longus for the flexors, so add that one in. It mainly flexes the thumb, right? But it does also flex the wrist a little bit. But down here, we've got extensor carpi ulnaris, we've got extensor carpi radialis longus and brevis, the ones that are already up there, but you can also throw in extensor digitorum, extensor pollicis longus, extensor pollicis brevis, abductor pollicis longus, and extensor indicis. All things that have more actions on the thumb and the finger, but you also can extend it at the wrist as well. Sometimes it's primary, sometimes it's in a sister. And also don't forget the extensor digiti minimi. I almost forgot that one, the small one that extends the pinky. So write these out, really practice, and then move on from there. Another time, radial nerve, we're talking posterior, but also notice brachioradialis. If I didn't say it before, the brachioradialis is the radial nerve. Even though it's considered more of a flexor, it's the radial nerve. So radial nerve does a lot. Now let's go clinically. If you cannot, let's say if you cannot extend your wrist or extend your elbow or extend your fingers, there's probably damage to that radial nerve. And it could be due to a crutch, having a crutch from, let's say, a leg injury, and just putting compression on that radial nerve as it travels down posteriorly to the forearm. You could also have fractures of the humerus or fractures down in the forearm that could damage it, but you're looking for essentially issues with extension for that radial nerve damage. Now with the median nerve, just think about what muscles it innervates. Here are all the muscles it innervates. So you would have issues with flexing the wrist, flexing the fingers, flexing the thumb, but then certain ones, just certain digits. So again, remember that division, but you might have injury, again, if you damage the humerus for the median nerve. And we're going to talk about this later as well, with something called the ape hand is the flattening of the thenar eminence. The median nerve also goes to the thumb. So if you can't contract your thumb muscles, they will get weak and small. And basically what happens is your thumb goes in more like this, and it becomes more of what's called an ape hand. So ape hand, apes, gorillas, monkeys, whatever, they have more of this going on rather than the thumb out to the side. So that's the ape hand. Now, not as severe of an injury, but more compression of certain nerves. The radial nerve goes underneath the supinator, here. So as it goes underneath the supinator, it can cause some compression. You also notice over here, the median nerve traveling straight down underneath the pronator arteries. So know the muscles that it travels underneath. And the last one of the three here, the ulnar nerve, you can get some ulnar nerve palsy in the fourth, fifth digit region. Let's say you're riding a bicycle and you kind of put your forearms or that medial side on the handlebars, and you start to get some tingling feeling going down your finger in the ulna bone. That's probably the ulnar nerve getting pushed or compressed against. And back to the ulnar nerve at the elbow, the funny bone, well, you can hit it, but you also can have cubital tunnel syndrome or ulnar nerve entrapment in this area. So something to note is that if the forearm muscles are just not functioning properly, they can get inflamed. And if they're not strong enough and they get inflamed, they can put issues or compression on this ulnar nerve. So that's why doing things like taking this and doing some extension of the fingers, or maybe you do some wrist curls or finger curls with a stress ball, doesn't seem like it's doing a lot, but it will keep your elbow healthy. It will keep the nerves healthy as well. And here's all three of them together. There are some other divisions coming from these, but we'll just kind of keep it to the main names of those nerves. And up until this point, we've been talking a lot about the muscles and the motor component, but let's talk more about the sensory component here. As we can see, a motor component deficit would look like a claw hand down here, but the sensory deficit would look more like paresthesia. And what do I mean by this? I mean, for claw hand, and we're looking at the ulnar nerve here, for claw hand, this individual is trying to bend all 4 digits. What you'll notice is that the 4th and 5th digit are staying pretty much straight, right? Staying straight like this, as you can see, number 4 and number 5. Well, we know ulnar nerve goes to the deeper sections of the flexor digitorum profundus, the one doing this flexion here. So really, you're just identifying the muscle of the ulnar nerve for the flexors that isn't working properly. But then 1.5 fingers, and I do want to make a division between 1.5 here for paresthesia, or you'll lose the sensation in those fingers, the 1.5 fingers there from the ulnar. And again, if you hit your funny bone, don't try that at home. You'll feel it go down through the 5th and half of the 4th digit on the medial side. All right, a couple more slides here, and just to reiterate the arteries that we've been talking about all before. Here we really can see the radial, the ulnar arteries. There is an interosseous membrane with an artery going through it, but mainly focus on ulnar and radial. But as you get to the hand, notice there's a deep palmar arch and a superficial palmar arch. What are these? It's like a cul-de-sac at the end of a neighborhood, right? So radial arteries, bringing it down, maybe you come down the ulnar, take your pick, right? But then you get to the cul-de-sac, and you really got to go to the one of the fingers, like someone's driveway, and it just kind of circles around like this. Now, if you're a blood cell, you cannot go up backwards up an artery, so you have to go over to the vein and then back up from there. From the dorsal or posterior side, we can see something called the dorsal carpal network. You could call it the dorsal carpal artery because that's one of the main ones in there. But now we're just on the dorsal or posterior side as it travels up. The arteries are on the anterior side, which is why you take the pulses on the anterior side, not the posterior, because you can feel the arteries on the anterior much, much better. Fractures of the ulna and radius, which I just had a friend that had this fracture, and easily fractured bones because they're much smaller, and they take on a brunt of the force when you land on them, let's say from a fall or falling down steps or something like that. We also can see some fractures on the distal end, and something called the collis fracture is the most common forearm fracture. So it often results way down here in the dinner fork deformity, to where the bones are less like a wrist and more like a dinner fork. So be careful with that. It's normally flat, but if the bones break, then you get a little bit of a curvature. Shouldn't really have that curvature, so they got to go in and fix those bones. Let's talk real quick about muscle testing. The flexor digitorum versus profundus. Again, if you can do this, then it's your flexor digitorum, profund or superficialis. But if you can do this just at the DIP joint, then you're testing your flexor digitorum profundus, because that's the one that flexes the DIP joint. Again, any sort of testing is going to test for issues with the nerves or issues with the muscle. If you cannot do the action of that muscle, that's a symptom or a sign that there's an issue in that muscle. All right, last 3 slides here. Cysts can be produced as well. Ganglion or swollen or not, just filled with mucus and different proteins, but a lot of things going on through the wrist. We'll get that in the next PowerPoint as well. But just note, any sort of extra bumps that would appear on the wrist are not normal, and a lot of them are synovial cysts. But back to the elbow, we can get elbow tendonitis. So just like doing the racket sports, got my badminton racket here, and just repetitive movements, much like this player's got going on right in here. Notice the external rotation of the shoulder. We've got some supination going on. We're putting a lot of stress on the medial compartment, the medial tendons of the elbow, as well as that UCL right there. So not just baseball, a lot of other sports and activities can produce issues in the elbow. But most often it's tennis and baseball, so they call it tennis elbow right here. And the technical name, you definitely want to know the technical name, is lateral epicondylitis. So this is more, not the medial side, but the lateral side. When you go from the position that's in this picture to when you actually hit it, that puts a lot of stress on the lateral side. So that can get inflamed as well. And that is your inflammation of the periosteum of the lateral epicondyle. Lots of pain and things like that. But again, strengthening the forearm can really help against that pain. And lastly, something you all might be experiencing, hopefully not, is called bursitis of the olecranon, the student's elbow. So if you have your elbows on a table for an extended period of time, you're hitting that olecranon, you're just rubbing it and rubbing it and rubbing it, and excessive friction is going to create that inflammation for the student's elbow. The good news is that if you stop doing that, and you put some ice on it. If it gets worse, it will be reduced and go back to normal. All right, that's it for the elbow to the wrist. We just have one more PowerPoint for the wrist and the hand, and then we're done with the upper extremity. Take some time, ask me questions this week, send me an email to set up some office hours. But now it's time for me to go back to some fishing and hopefully catch something.